How are you?
Angela, nice to see you.
Doing well. Hello, my name is Angela Spinella. I am the manager of outpatient pediatric services, and I have here with me today.
I'm Dr. Kelly Woodfield with Pediatric and Adolescent Gynecology.
This is a new program that we have at Valley, which we partner with Mount Sinai. So our community has a couple questions for you. So our first question today is, what is pediatric and adolescent gynecology, and why is it important?
A lot of people are surprised when they hear that pediatric gynecology is a thing. So pediatric gynecology is a branch of OBGYN where we specialize in managing the gynecologic needs of kids from birth up to like young adulthood around age 19 to 24 or so, kind of depending on the problem.
What are common pediatric gynecologic issues parents should be aware of?
I kind of break it down into kids who have not gone through puberty and then kids who have gone through puberty. So for our youngest ones, I'd say the most common things that we see are itching of the vulva or discharge. There's some dermatologic or skin conditions that can affect these kids because that skin is really fragile and sensitive because it just hasn't been exposed to a lot of estrogen at this point. And then for our kids who have gone through puberty and are having periods, we deal with a lot of period problems. So it's heavy periods, painful periods, irregular periods, periods that never started, PCOS. We also deal with a lot of pain. So we're surgeons, so we do diagnostic laparoscopies for endometriosis. We're also, I would say, the queens of taking out ovarian cysts because our teens get a lot of cysts.
That's good to know. When should a child see a pediatric gynecologist?
Obviously, they should see us if they have any kind of complaint that's been bothering them, or you feel like it's really interfering with their ability to go to school or to do the things that they love. But we're also happy to see kids whenever they just have a question about their body. It's sometimes really hard to know what's normal and what's not normal. We love answering those questions.
Which is good to know, because some parents are like, oh no, it's just your period, like there's no problems there. And it's like, there could be something else going on. So that's good to know.
Yeah.
What can parents do to promote healthy gynecologic care at home?
You know, a lot of it is body positivity. We say that periods are like a special vital sign for girls. And so just general health and, exercise, nutrition is all going to promote good gynecologic care. We also like to talk a lot about some of the products out there that are, marketed to rejuvenate the vagina. There's all these soaps and things out there. And we really say, and I apologize for this analogy, but we say the vaginas are like self-cleaning ovens where really you don't need anything special down there. In fact, we recommend that just in addition to kids just regular bath or shower, that the soaps that they use should be unscented, or even, don't use soaps at all. And honestly, bubble baths are like the enemy to the vulva. We really just water, really minimize the amount of soap that's down there.
That makes sense. How can parents address body changes and puberty in an age-appropriate way?
Oh, it's hard. It's hard. And I think it's a conversation that really needs to happen throughout the lifetime and not be reserved to a one-time talk, around puberty. And a lot has to do with just normalizing the different body types and shapes that are out there because, it may be that your kid doesn't develop in the same way that you did. And just normalizing that there's a wide range of normal. And we're always here as gynecologists to answer questions if you're uncertain as well.
Yeah, it's good because kids can smell fear. So you want to go in there with confidence to say, and talk about it over time.
Oh, they're so good at smelling. So a lot of it is being comfortable in your own body as well. And we always encourage parents to use anatomically correct terms as well. It helps minimize the awkwardness a little bit.
That makes sense. Are IUDs or intrauterine devices safe in teens?
We get this question a lot, and a lot of parents are surprised when we even bring it up in our visits. And if you spend any time with a gynecologist, I think that they're going to try to talk you into an IUD. And we know that they're not for everybody. It is kind of a big step, but we love them because they fix so many of the problems that we see as gynecologists. So not only are they great for birth control, but they help manage, the heaviest of the periods and the most painful of periods. And the truth is that if someone's having a period, their uterus is adult size. And so that IUD is going to fit just as well as for a woman who's had a baby before. And one of the things that we do in pediatric gynecology is we specialize in ways to place these IUDs in a way that's kid-friendly. Most teens are not emotionally or mentally prepared to undergo a pelvic exam, and really minimizing the number of pelvic exams we do is something that's really important to us because we can cause a lot of trauma if we just do it, if we treat these kids the way that we treat adults. And so one thing that we do is we offer IUDs under anesthesia, and we're also pioneering new ways to help manage pain and anxiety during the IUD insertion process.
That makes sense. And why should our community choose Valley for pediatric gynecologic care?
It's amazing, and like not only is the clinic and the hospital like really well situated within the community, they have state-of-the-art facilities. I've been in the operating rooms; they're incredible. But I also think that their partnership with Mount Sinai and having access to the most cutting-edge care, not just for gynecology, but for all the ways that gynecology intersects with some of these other disciplines, urology, GI, endocrinology. We have access to the best of the best here.
That's true, yeah, and you have all the different subspecialties along with our pediatric and adolescent gynecologic program. So if you're looking for any pediatric or adolescent gynecological care, Dr. Kelly Woodfield is with us at our 140 East Ridgewood Avenue location and our location in Montvale, which is 135 North Kindercamack Road. So if you have any questions, please call our number, and we look forward to seeing you.